works well in arthritis, especially of the small joints. You can't really use it on the hips because of the location of the hip is not only so deep, but it is shielded by much of the area of the pelvis. Myofascial trigger points is probably its clearly most rapidly beneficial use. It works for bursitis, for carpal tunnel syndrome, for plantar fasciitis, and always look for trigger points in the calf muscles as the cause of the symptoms of this. The same with heel pain, because a lot of this plantar fasciitis isn't. It is just referred symptoms from trigger points in the calf muscles. Greater occipital neuritis is commonly entrapment by the tight muscles in the neck that irritates this nerve and gives you pain and occasionally numbness and tingling in the C1, 2, and 3 dermatomes on the face and the upper neck. Sprains and strains, healing are affected as our ligament injuries are affected in terms of more rapid healing. Tennis elbow is again relieved as much by dealing with the trigger points in the muscles whose tendons cause this problem, and then only treating the epicondyle if the pain persists. The same is true of tendinitis anywhere in the body where you find it. We've talked about wound healing, acupuncture points, and one of the areas that is under significant development and active investigation is the use of some acupuncture points stimulated by applying the low power laser to a certain number of these to facilitate smoking cessation, as well as weight loss and easing stress. And should this prove definitive, I think it would probably move to the top of the list for the use of low power laser for temporomandibular dysfunction and these muscles of mastication with trigger points. It is very useful, and I've developed a technique for using the laser which I will get to, which treats the sphenopalatine ganglion in the head to treat migraine pain, which is unresponsive to the conventional treatments. Precautions with a laser: obviously, you don't want to go right over the uterus when a patient is pregnant. And this is simply a precaution to avoid any concerns that might develop should there be a problem with a baby that's not likely to have been caused by the laser but might be blamed on the laser. So avoid going over the uterus. I've frequently treated people above the diaphragm who are pregnant when it's necessary to do so. Obviously, you want to protect the eyes. There is a general feeling to avoid treating right over the thyroid, as this may stimulate a hyperthyroid reaction. What is interesting is there's a recent paper that has just come out on a pilot study which showed significant improvement of Hashimoto's thyroiditis by treatment with a low-power laser. Tattoos, especially the ones that are dark red or dark black or blue, will not allow the laser to penetrate through that solid tattoo. On the other hand, if you find space between those colors, the laser will penetrate that skin. And skin color is irrelevant. And that has implications far beyond medical treatments. But clearly, it makes no difference whether a person is white, black, brown, or yellow in terms of their skin color. The response, I should say, the response to treatment for pain is successful in all of those types of individuals. Remember I told you about the single beam acupuncture type head on this that fits on the end of the ML830. It is ideal for going over small trigger point areas, for doing the migraine protocol, for doing acupuncture points for smoking cessation, doing dental treatments and jaw muscles, as well as small joints. This, in effect, turns the 3 beams into 1 beam. As before I mentioned the treatment of migraine. If the usual cocktail of medications, including triptans and beta blockers, is either not effective, or they desire to stop them in, for instance, in young girls who are maturing, and there's some concern about whether these medications will create problems in terms of fertility, etc. And parents want to get their children off of these medications. The laser offers a useful tool. First of all, it's really important to inactivate all the trigger points, because many people who are labeled migraine simply because they have severe headaches and nausea and light and sound sensitivity do not in fact have migraine. They have myofascial headaches, which are generated because the muscles in the posterior and lateral neck have become very active, either entrapping nerves or simply referring pain into the areas where the patient is complaining of headaches. And many of these patients are just labeled migraine by well-meaning but incorrect primary care or neurology specialists. I attended a seminar by Barry Glassman, who's a dentist, who has been using injection of the sphenopalatine ganglia to treat all sorts of headaches, including migraines, over the years. And he sort of does it in his corner of the world. What's interesting is Botox, which has now been approved by the FDA for the use in treatment of migraines, when it's injected at the glabellar areas by a plastic surgeon or dermatologist seeking to reduce the wrinkles in that area. The patients coming back 3 months later for a redo of Botox have asked why their migraines have gone. And what appears to be the case is that while we know that Botox only works where acetylcholine is involved as the transmitter in an area, we do know that the usual culprit thought of in migraine, where it is thought that these blood vessels on the lining of the brain tend to open and close, and this is what they dilate and constrict, and this is what gives you the various symptoms you see in migraine. Well, there's no acetylcholine in these areas, and the injections of the Botox were never done in a place where you'd expect the Botox to get to these places easily or at all. But if the injection is in the glabellar area, the sphenopalatine ganglion is located about 1 inch below that area, just on the surface of the ethmoid plate, which is at the end of the nasal cavity. And there the transmitter at these ganglionic cells is acetylcholine. So Botox would work there, and it explains why Botox action on the sphenopalatine ganglion would stop a migraine headache. This is not widely known by neurologists or by any other groups of physicians. Now, what I have done is I took this information and I went back to my practice, and I had roughly half a dozen patients who'd been all over the country looking for solutions to their migraines and had been unable to achieve any significant results in terms of relieving their pain. Out of the 6, I have now completely stopped migraines in 2, partially stopped them in the other 4. I most recently had another patient, which I will include in the series, who is a 15-year-old girl who was having constant migraines for the previous 4 months and had had a history of migraines for about 4 years. And her mother was at her wit's end because she wanted her to stop these medications, and they wanted to put her on even stronger ones. And luckily her pediatrician had been treated by me, so she said, why don't you come and see if this could help? Well, I started using the laser right above the zygomatic arch, aimed below the eye socket, right at where the sphenopalatine ganglion would sit. And lo and behold, within about 5 minutes of treating both sides, both the left and the right, the migraine headache disappeared. And any residual pain was handled by getting rid of trigger points. I try to get rid of all of them ahead of time. If there are any left, they show up after this treatment, and then I get rid of them, and the patient initially got a day or 2 of relief, and after the 3rd or 4th treatment was getting 1 to 2 weeks of relief, and after about either 8 or 10 treatments now, she has basically converted from a migraine problem to a myofascial problem, and simply inactivating her myofascial trigger points gets rid of the headache, which she may get back if the weather changes or something, but at least 3 weeks of pain-free days. And obviously her mother is overjoyed. Carpal tunnel problems are not unusual. They were the major reason that the ML830 was approved by the FDA, and it is a very good substitute for surgery in these patients. And it's especially useful in people with relatively mild symptoms, where 1 or 2 treatments can easily resolve it. Even when the patient is dropping things and has a little bit of atrophy, that the laser is very effective in removing the symptoms and allowing the patient to heal. One thing that's important to remember is this a pure carpal tunnel, or is myofascial pain with referral into the wrist and fingers part of the picture? And remember, the first dorsal interosseous muscle is often the cause of many of these so-called carpal tunnel syndrome problems. And you also have to make sure that you're not dealing with a peripheral neuropathy from some other cause, diabetes, of post-herpetic symptom, radiation, heavy metal poisoning,